Hospital medicine is actually a relatively young subspecialty. It formed in the late 1990s. The term hospital medicine was coined actually in adult hospital medicine, and we started actually a hospital medicine service where we did inpatient and outpatient here in about that time. We specialize in the care of hospitalized patients, so we don't see any outpatients at all, for the most part, at least here at the Cleveland Clinic. We take care of all the inpatient or general pediatric patients who get admitted to the hospital. And as inpatient care becomes more complex, and the rules and regulations that we need to follow and compliance issues that we need to follow have become more complex, a lot of the outpatient docs have stopped seeing their kids in the hospital. So we fulfill that role for them and become part of the care team. So usually we get to receive a family who wasn't planning on coming to the hospital that day. So a lot of times there's a lot of anxiety and sort of trepidation about what's going to happen next, or they didn't realize their child was critically ill, or they knew they were, and now they're at the next phase of care. So we come in and introduce ourselves as pediatric hospital medicine attending, and that we're here to continue to facilitate their inpatient care, working very closely with their community pediatrician. So be it a private doc or a doc who works in our system, we make sure that they understand that that connection will be complete for them. There's the patient, but quite honestly, if you don't make that connection with the family, you're not going to have a positive experience, because most of these kids are young. I mean, they can tell you how they feel, they can tell you that they're not well, for the most part, even from a very young age, but they're not going to necessarily know what that means and or make the decisions about their care. So without involving the family or making that sort of connection with them, you're not going to have a positive experience. So for us, for inpatient and for our type of service, that interaction is critical.